My name is Richard Hain, and I'm a surgical oncology fellow at the University of Pittsburgh Medical Center. I'd like to summarize our recent analysis on Medicaid expansion and colon cancer in the United States. The Affordable Care Act, passed in 2010, has become perhaps the most polarizing piece of legislation in recent history. While mostly unsuccessful, efforts to overturn the law continue, including a case recently presented to the Supreme Court. One main feature of the law was the federally subsidized expansion of Medicaid eligibility to increase health insurance coverage among low-income Americans. While most states have expanded Medicaid, many have not. This uneven adoption of a new program creates a natural experiment with which to study the impact of the law. Using the National Cancer Database, we compared colon cancer diagnosis and management in states that did and did not expand Medicaid coverage in January of 2014. We chose to exclude patients who were covered by private insurance or Medicare, as they were unlikely to be affected by Medicaid expansion. Using a quasi-experimental difference in differences approach, we assessed changes in Medicaid expansion states that were different from non-expansion states. For example, Medicaid coverage in non-expansion states increased by 4 percentage points over the study period, whereas it increased by 21 points in expansion states. This was a significant difference in differences after multivariable adjustment, which suggests a strong correlation with the new policy. Using this approach, we compared a host of patient, tumor, and treatment characteristics available in the dataset. Our first significant finding was an increase in stage 1 diagnoses in expansion states. Corresponding with earlier diagnosis, expansion states showed a relative increase in minimally invasive surgery and a decrease in urgent surgery. These findings suggest improvements in colon cancer screening and diagnosis related to Medicaid expansion. Other findings point towards improvements in healthcare access. After Medicaid expansion, patients traveled further for care and were more likely to be treated at an integrated network cancer program. Early-stage patients in non-expansion states experienced delays in care that were not observed in expansion states. Finally, use of palliative care services for stage 4 patients increased in expansion states, where it did not in non-expansion states. Taken together, these findings suggest that Medicaid expansion has improved the diagnosis and management of colon cancer by increasing access to health care for previously uninsured Americans. As political and legal battles continue, it is important to understand the impact that the Affordable Care Act has already had. Our study is part of a growing body of literature demonstrating the many positive effects of improving access to health care in the United States.